All right, thanks, Brett. Okay, welcome and afternoon, everyone. Thanks for hopping on the call, our weekly update call with us. Um, we'll go ahead and move forward just like we normally do. We'll start with some data and let Jordan, our epidemiologist, kind of take over, and then we'll provide some update information on vaccines and answer any questions that people have. So, Jordan?
All right, hello everyone. Hopefully you're seeing the MySafe Start Excel county data. Manistee is in risk level A, Mason is in risk level B, Lake, Mecosta, and Oceana are in risk level C, Crawford, Kalkaska, and Wexford are in risk level D, and Misaki and Newaygo are in risk level E. Our daily cases per million and percent positivity do continue to increase. So you can see last time we had a daily cases per million average of 76.9. Now it's up to 100.2. And then percent positivity had a slight increase to 6.01%, up from 5.65%. Our cases have also increased over the past week. So there were 270 new cases this past week, and the week before that we had 202 new cases. So we have seen a 34% increase in cases between the weeks. The cases we saw this past week were identified as household and community contact, school, including college, religious services, pre-surgical and inpatient testing. There was a sports team exposure and worksite exposures. Our total number of jurisdiction-wide cases as of yesterday at 3 o'clock was 12,047. Cases by county as of yesterday are Crawford with 573, Kalkaska 600, Lake 350, Manistee 755, Mason 1,160, Mecosta 1,944, with Ferris State reporting 619 cases, Misaki 674, Newaygo 2,791, Oceana 1,812, Wexford 1,388, and in the past week there were 2 deaths reported and 233 people recovered. Yesterday there were 2 positive inpatient cases at Munson Healthcare Cadillac, 5 at Munson Grayling, 1 at Munson Manistee, 0 at Spectrum Health Big Rapids, 3 at Spectrum Health Kerber Memorial, and 0 at Spectrum Health Ludington. Now I'll share our vaccine table with you. We did add a couple additional columns this week as well. So you should be seeing the vaccine table now. The blue columns are just DHD number 10 clinics, so that helps separate from things that were pulled from the state versus just DHD 10. So DHD 10 has given 39,166 vaccines as of Sunday, March 7th. 13,101 of those were second doses. And then according to the state dashboard, 71,457 total doses have been given within our counties. So you can see the number of second doses given in the county, how many doses have been given to the 65 and up population, the percent of vaccine given to the 65 and up population, and then these 2 columns that were added are vaccination coverage initiation, which means that somebody started their shot series, and then vaccination coverage completion, which means they have finished their vaccination series. So that is the number of people that have had both of those. So the completion is the people that are done with the vaccine series. There is some slight discrepancies between the completion and the number of second doses given. Some of them do match, but some do not. So we are following up on why that could be. My initial thoughts are that someone might have had a reaction to the first dose, so it wasn't recommended they get the second dose and they're being counted as completed, but I'm not completely sure if that's true. Another reason could be a delay in the reporting of the data. The data does change day to day and hour to hour, so that could also explain it. But They have followed up on that, so hopefully we'll have an answer for you next week on that. Are there any questions?
All right. If not, thanks, Jordan. All right. Other information related to vaccination. We do continue to do clinics Wednesdays, Fridays, and Saturdays. Saturdays, for the most part, are larger second dose clinics that we have going on in the jurisdiction. So this week, we'll have. This week's going to be a little bit. Well, this week will be a little different. Wednesdays will be all first dose clinics. Friday will be kind of a combination in some of our counties of first dose and a second dose clinic, and then Saturday will be all second dose clinics that we have going on. So we have bumped up the number of slots that we'll have available in each county. So again, in discussing with our staff, it's felt that we can fit a few more people in. So the number of slots that we have available is going to be increasing in each county. In terms of getting people scheduled and in, we're using kind of a combination type where we're putting links that people can go to sign up for clinic appointments. And for the most part, have found that, unlike when we did it the first time, and had to cancel a bunch of people, we have not encountered that. We've had to cancel a few people outside the area or don't meet the age criteria, but for the most part, it has not been a big issue. So we continue to use those electronic means, and then also working off of our wait lists that we have. Originally was for the 65 plus population. Now that's moved to the 50 plus population, calling individuals off of there to get them into appointments. So kind of utilizing that old school method of getting people in. So our hope is that as we continue to move forward, we'll be able to focus more in on the electronic means to get people into clinics and get them registered. So that'll just make that whole process a lot more efficient. So the state did update the vaccination prioritization guidance, and that took effect on Monday the 8th. And what the state's guidance, where they moved, was they dropped the age from 65 plus, they dropped it down to 50 years and older with health issues or medical disabilities. And then they also included in caregivers. Caregivers are family members of guardians of children with special needs. Those were the two new populations that were added in. And then the understanding was that as of the 22nd of this month, it's anticipated that it will go 50 and 50 plus across the board with no specific conditions will be eligible for vaccination. District Health Department number 10, in collaboration with our other northern health departments in the northern lower peninsula, as well as up in the UP, we did decide to make more of a regional approach to this. And so, while yes, we are honoring those, the caregiver, family members and guardians of children with special needs, those individuals are eligible. For the age group, though, we went effective Monday just 50 plus, regardless of any health or medical disability. To kind of sort that out and police it was going to make more of a headache on our part. So right now, individuals 50 years and older are eligible to be vaccinated in our jurisdiction, as well as in the other Northern Michigan Health Department jurisdictions and in the UP. We also have added in the 1BC work group or eligibility groups. So that would include the food processors and agricultural workers were already included in the prior guidance, but we now are also opening up with critical manufacturing, public transit workers, grocery store workers, U.S. Postal Service workers, and then workers with unique skill sets not covered above, such as non-hospital laboratories and mortuary services. Mortuary services, we've already reached out to those folks, so most of them should be done. So we created a much broader audience and population that is going to be eligible for vaccination. And our reasoning for doing that in talking with our healthcare partners or health department peers and partners in the UP and in northern lower Michigan, just working off of that 65 plus population, we know there's still a number out there, but it was getting harder and harder to get those, to find those people and get them into clinics. So we made the decision, along with those others, to expand that, expand it pretty greatly to allow additional people to get in. Now, we know that that's going to create some bottlenecks, and we'll have everybody wanting to get in initially, but it is still going to take us time to get through everybody. And so we're going to ask for your patience as we move through that process of getting people vaccinated. We did see a slight increase in our vaccine amounts that we've got, a little bit more Pfizer vaccine that we are getting. Moderna has stayed pretty much about the same. We also did receive an allotment of the Johnson & Johnson vaccine. The state as a whole received about 82,000 doses of the Johnson & Johnson vaccine, and that was distributed out to primarily health departments, but some hospitals also got doses of the Johnson & Johnson. It's not expected that we'll see any additional Johnson & Johnson until the end of March. Johnson & Johnson basically shipped out everything that they had in stock once it was approved, and now they're kind of ramping up production to kind of restock it. So the Johnson & Johnson vaccine, we are not doing just for the general population at this time. It's really been prioritized for those populations that have a difficult time getting into a 2-shot, getting back in for a second shot, or taking part in a 2-shot series. So it could be those homebound populations. It could be the folks that are at our long-term care type facilities, or not long-term, homeless shelters. It could be our seasonal or migrant farm workers that are in the area. Right now, those are the groups that we're prioritizing that vaccine for. So we are working to create a plan to be able to roll out the Johnson & Johnson vaccine and begin to vaccinate those individuals. Right now, I don't believe we'll have any special clinics, but it'll more be, on a daily basis when we're not doing another larger clinic. Our staff will probably have a list of individuals, and they'll be going out, hitting the road, and vaccinating those people at home. At least that's what our plan is right now. So we'll see what happens with that. So that's kind of the big news with vaccine and with vaccinations. Again, kind of waiting to see what our weekly allotments will be for Pfizer and Moderna vaccine. I was on a state call earlier. They're anticipating it kind of staying level. We know the pharmacies are also getting additional vaccine. They're getting it directly from the feds. So Rite Aid and Myers continue to increase the amount of vaccine that they're receiving and are vaccinating out in the communities. Some of our FQHCs have also started to receive vaccine, and so they are vaccinating their patient populations and others. I don't believe a whole lot has been filtered out to the primary care offices. What the primary care offices are getting is really coming from the hospitals or the health systems that are receiving vaccine. So we do continue to talk with our Spectrum and Mercy and Munson partners so that we're kind of staying in the same page and not tripping over each other with vaccine and our vaccination efforts that we have. There was a question on last week's call regarding the efficacy of the Johnson & Johnson vaccine, so I did reach out to our medical director on that. And overall, Johnson & Johnson has been found to be 66% effective at preventing any symptomatic lab-confirmed infection after 14 days or longer after infection. It's been 74% effective in preventing asymptomatic infections, 85% effective against severe infections, which again, it's more, reducing hospitalization, and then 93.1% effective against hospitalizations by 14 days after vaccination. So it does, it is an effective vaccine as a single dose vaccine. So those individuals getting that, will have will still get that protection that they, a little less overall than what Johnson or when Moderna and Pfizer is, but still a highly effective vaccine that will have in our arsenal to address, COVID prevention with. There also was released yesterday from CDC some updated recommendations for those individuals that are fully vaccinated, and I would imagine that we're going to continue to see newer guidance coming out related to vaccination of individuals. But the newest recommendations are that fully vaccinated people, and again, for the most part, this is individuals who have completed their 2-shot series, and it's assumed after your second shot, full immunity is achieved after 2 weeks from that second shot. That individuals who are fully vaccinated can visit with other fully vaccinated people indoors without wearing masks or physically distancing, so that 6-foot distance. And they can also visit with unvaccinated people from a single household who are at low risk for severe COVID-19 disease. So not those vulnerable populations, indoors without wearing masks or physical distancing. And then they could also then refraining from having to quarantine and testing following a known exposure if they remain asymptomatic. And that one had been out there before. The new quarantine guidance is if a fully vaccinated individual is identified as a close contact and it's been 2 weeks or more, but no longer than 3 months since their last shot, then they do not have to quarantine. So again, I expect that we'll continue to see guidance like this coming out as more is learned on the vaccine and how long the effectiveness will last for. So I think that may be all that I have to share right now. So if there's questions, we can go ahead and answer those.
All right, Joseph, go ahead.
Yeah, my question is in relation to the homebound people. Just wondering if their case managers should supply you with names and numbers, telephone numbers on that.
Sure. If they have the contact information, we can kind of take, that'll help. We can reach out to them and try to schedule appointments and take a day, and depending upon how many we can get scheduled, we can do that. If you have any large, I don't know, Joseph, if you've got any events or where people are coming in, but that could be another option in terms of a clinic setting. But yeah, definitely, if you have contact information, those, and you want to share with me, get that information to me and I can pass that on to our nurses in that appropriate county.
Okay, thank you very much.
Wendy, go ahead.
Our Human Resources Department had a question. For people who are fully vaccinated and they think that they've had an exposure to COVID, we know they don't have to work remote, but what about just general illness? What do we do with that?
General illness.
If they are sick themselves, are we still asking them to work remote? So that we're not spreading any other kind of illness?
I mean, it would probably make sense to do that. Again, remember, the Pfizer or the Moderna vaccine is 90 to 95% effective, so it's not 100% effective.
Mm-hmm.
And they're not saying that the person, can't still transmit the virus, although the potential is very, very low. But to be completely safe, I would, yeah.
Okay.
All right, Terry, go ahead.
Whoops.
I guess if I can, one other thing, Wendy, probably maybe the one qualifying piece to put to that might be if their healthcare provider has diagnosed them with something else.
Meaning, I'm not.
So if they had a strep infection and they put them in an antibiotic, then they would probably say, okay, you need to stay home for X number of days as opposed to longer period of time.
Okay.
Jennifer, go ahead.
You mentioned earlier something about cancellations of appointments based on location. Can you just clarify what you meant by that? I know there's been some changes. Originally, it sounded like there weren't limitations on who could schedule where based on like residency. But I just want to make sure I'm understanding that, because I'm seeing on a lot of the county sites, like we're only vaccinating residents of our county. And so with our staff, many of them work in our county, but don't necessarily live in our county. So just want to make sure I'm giving them the right direction.
Yeah, no, the individuals, you know, you're right. There is no residency requirement. The individuals that we have canceled because of that neither live in our jurisdiction nor do they work in our jurisdiction. So it's people from down in the Detroit area or the southern part of the state who are looking and searching anywhere they can to get a vaccination. So individuals who work in our jurisdiction, yes, they are eligible.
Okay, thanks.
Wendy, did you have another one?
Well, I hate to say it, but I'm not 100% sure that I understand. And I'm not 100% sure that I put this question out there so that it could be, so that it's answered the way it is going to be understood by HR. If we have someone who is sick with something and it's not COVID, do we limit their access to the people that we take care of so that we're not exposing them to anything else that, you know, that's our question. We know that we don't have to have them work remotely if they've been exposed to COVID or if there's COVID in their household, but they're fully, you know, am I making sense?
Yeah, so again, you know, the guidance is out there really around COVID infection. And so
Right.
if you have someone, if you have someone who, you know, they is sick and they test negative for COVID, then, you know, and the doctor says, well, they, you know, it's not COVID, but it's something else, that would, you know, again, I think that's something that's going to fall under your normal policies as to what you would do in terms of, you know, just like the flu. If you have somebody sick, I'm assuming you don't want them in with the flu. You don't want them at work.
Yes, exactly. Okay. We've just taken a very cautious stance on that. And I think now that we are doing more face-to-face kinds of things, we just wanted to make sure that we are doing all that we can do. So that does help. Thank you.
Okay.
Anybody on the phone that has a question, go ahead and unmute and you can ask. All right, Terry, go ahead. And Terry, you're still muted if you're trying to ask your question.
Hello, can anybody hear me?
Yep.
Yes.
Okay, good. I'm playing around with this. I work in the correctional facility here in Baldwin.
Yep.
And I just want to know an estimated date or time when we can think about start immunizing the inmates.
That is, you know, that's an interesting question, and I need to get some clarification from the state on that, because the state has put guidance out related to the Michigan Department of Corrections inmates, and I know they're supplying vaccine to vaccinate that group. My original thinking was that, you know, that Johnson & Johnson vaccine might be an appropriate use with that population. I just need to reach out and you know, get confirmation from the state that they agree with that.
Right.
And if we are supposed to consider, you know, the North Lake Correctional inmates in the same, in the same way that we would consider Department of Corrections people, because they have varied a little bit. So I need to reach out. So I need to reach out and get a little more clarification on that. I just haven't had a chance to do it yet, but I will.
Okay, Kevin. We checked with the feds way back when this started, and they said we were supposed to reach out to our individual states. Now, I don't know if that was just the direction from the federal government or that's exactly what we're supposed to be doing. So any help that you can give us, we'd appreciate, because people are starting to ask. Our higher ups are starting to ask at least about a projected date to start.
Yeah. Have all the guards there that have wanted to be vaccinated been vaccinated?
We put it out, and I know that the staff is getting vaccinated. So they have those who want it have the opportunity to go get it.
Okay. I will follow up on the residents and get back with you.
Okay, that sounds great. Thanks.
Okay. Yep. Other questions?
Looks like that was the last one.
Okay. Anyone else? Anyone on the phone? Okay. As I said, we do have clinics. This week kind of is going to be our big week. We do have the National Guard coming in to help supplement our staff in our vaccination clinics. So we do have the Guard coming to a number of our counties to work with us. That is going to kind of continue as we move forward with vaccination clinics. Looking at Wednesdays and Fridays being first dose clinics, and then our Saturdays being larger second dose clinics where we may have in excess of 600 or 700, maybe even 800 individuals coming through. So some of those will not be done at our office. They will be done in an off-site clinic location that we have. When we are off-site, because we're basically using all of our staff that we have, our offices may not be open. We still intend to have call centers where we'll be routing various calls to, or my cell phone number is our actually after hours emergency number. So even though our offices are closed, individuals would still be able to get a hold of the health department in the event that they needed a service, so or needed something. So just because the office itself may be closed doesn't mean that you would not be able to contact somebody at the health department. So just keep that in mind. On our website, we do have our wait lists out there for the 65 plus population and the 50 plus population. We also have interest surveys out there for the various priority groups. We've had a number of individuals, a number of organizations, number of businesses already complete that interest survey for the 1BC group. And so as we work through that, we're starting at the top of that list because there is a date stamp on those, and then working down through the rest of the of those lists. So depending upon where an individual or an organization may fall on that list, it might take a little while to get to you. But again, if you have employees that are 50 plus, they can go on and get on our list now to get vaccinated. I know we've heard some things that because we've opened it up to the 50 plus that we're not concerned about the 65 plus, or that we're forgetting about the 65 plus population, and that's not true. We are still continuing to work at getting that 65 plus, those individuals that were on our original waiting lists to get in and get vaccinated. We're making numerous attempts to reach out to them, but in talking with our registration staff, some of the issues that we're running into is, people not answering the phone. And again, my guess would be for fear that it's a scam. We do leave messages, although we're encountering a large number of individuals who don't have a voicemail set up or their mailbox is full. So, we're trying to reach out to those folks as best we can, but it can be a challenge sometimes to get to them. We also know that in at least one of our counties, Mecosta County, we've had 3 situations crop up, and these have been referred to law enforcement, where individuals have reported to us that someone claiming to be the health department has offered to sell them a vaccine. We do not sell vaccine to anyone. We also know that someone has claimed to be the health department and has offered them a $30 gift card if they would allow that person to vaccinate them. We do not provide gift cards to anyone. We're not going door to door. If that were to be something that we were to even look at, it would be along the lines of trying to get to this homeless population, the homebound population. We would have appointments set up, and they would, individuals would know in advance that somebody's coming. So if you hear anything like that, let us know. I'm not sure why, for whatever reason, this is kind of all only happening in Mecosta County, but that's where we're having it right now. And as I said, we have reached out to law enforcement on that. But if anybody hears of that or those issues, please let me know so that we can try to get information out there to other people about that. So is there another question, looks like?
Yep, Jeff, go ahead.
Yeah, my question is in regards to the different types of vaccines. There's quite a difference between the 2-dose and a single dose and the effectiveness, and some people are comfortable with one and not the other. And at the current moment, is there any chance of direction that can be given to those that want to choose one over the other?
Unfortunately, we don't know from week to week. Like if we're talking like Pfizer and Moderna, we don't know from week to week what we're going to get for vaccine or the allotment. And so with the Pfizer vaccine, because it has to be stored in that ultra cold storage, it's really not. It makes it difficult if we have to try to transport that throughout all 10 of our counties. We've done it. And if we have to, if that's what we're getting a lot of, then we'll do that. But really, we're trying to limit the Pfizer vaccine to being used in, Mecosta, where we have our ultra cold storage, Newaygo, possibly Lake and Wexford counties. And then Moderna vaccine is a vaccine that's a little easier to store, so we can store that in all of our offices. And not, that's just easier to not have to move around. But again, it really depends what we get on a weekly basis. If someone would prefer that, they want to wait for the Moderna vaccine, if we don't have it in that county, we can try to get them in another county to do that, or we can put them back on the waiting list until, we're using Moderna in that county and then try to call them in. Johnson & Johnson, as of right now, is not, we're not doing anything for the general public with that. I would imagine at some point we will open that vaccine will get opened up to the general population. It's just not right now. Did that make sense, Jeff?
Yep, thank you.
Okay. Other questions? All right, guys, if not, that's what I have to share today. Again, if you have other questions, go ahead and reach out to me. We'll try to get you an answer, or if you think of something after today's call, email it to me. If you have individuals that meet that homebound criteria, reach out, let us know so that we can get them on a list and try to get those individuals vaccinated. We're going to work with our Council on Aging, the Area Agency on Aging, senior centers, all of those to try to identify who those folks are, so that we can get them in and get them vaccinated with that vaccine that we have. Other than that, that is all I have for today. Again, thanks for taking time to hop on the call, and we'll get back together again next week, Tuesday at 3 o'clock to provide another update to you. Thanks, guys.